Dio tremenda alegría porque parece que tengo, porque yo pensé que si no se descubre eso ya no estuviera haciendo un cuento aquí. Tengo una segunda vida nueva. Sí, 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 eso sí es positivo. Yo sé las consecuencias de eso cuando dan las hemorragias ese en el cerebro, eso no es fácil.
Xiomara had come to Memorial with high blood pressure and headaches. And initially, it was felt that she could also be suffering from a stroke. And so the scan showed that while there was no active bleeding in the brain or blockages of any blood vessels, she had multiple aneurysms within the brain.
Of course, they were very concerning because not only did we find one, but there were a whole bunch. There were too many. And so urgently she needed to be and admitted and have surgery. So that was a huge shock.
I'm glad that the family and Xiomara sought attention quickly, because had these aneurysms gone unidentified and hence untreated, they could have, especially among the larger ones, could have spontaneously ruptured. Now, since the early 90s, these treatments have become more advanced and minimally invasive, where we no longer have to do the open surgery. We can now go through arteries, similar to cardiologists performing a catheterization procedure. We go through the artery either in the leg, and more commonly these days through the arm or the wrist, and we're able to navigate with our catheters and wires under X-ray image guidance all the way up to the level of the neck and into the brain, identify these aneurysms very precisely, and study the anatomy and determine the most appropriate treatment. The more advanced treatment over the past 5 to 10 years involves not even going into the aneurysm in the majority of cases, instead bypassing them, what we call flow diversion. And that is what we performed for the aneurysms in Xiomara's case, where we implanted a device called a flow diverter, and we used the latest one that has many advantages compared to the previous line of flow diverters, where it's more visible, it's easily navigable to the site of the aneurysm, and is quickly deployed, implanted, making the procedure shorter and a faster recovery.
For every procedure, I've done a group chat. I keep everybody abreast at every single step of the way of what's going on with her, and just even the MyChart itself tells you. So I'm very impressed with how we've come along with the electronic health record and just messaging and texting and everything. But again, Dr. Mehta's office themselves, everybody included.
Memoria, el equipo ha sido lo máximo. Y todo ha sido bueno, todo. No tengo queja de que no, que esto no pasó, que no. Siempre estaban pendientes de todo. Sí, sí.
See these patients in the follow-up in our clinic when they're no longer, recovering from the anesthesia and in bed during their hospital stay, but rather seeing them walking independently into our clinic, smiling, and especially seeing Xiomara without any neurological disability was very fulfilling. And to just see how grateful she was and her family members with everything that she's been through over the last few months in the new year, that she's back to a meaningful quality of life.